know, we're almost finished with the first half of the show, by the way. It goes way too fast always. But in the second half of the show, I was wondering if maybe using Vinci as I don't want to use the word guinea pig, but using her as a model, maybe we can explain or show just some of the things that you do.
Sure.
While we're doing that. And just, we have just a couple more seconds. How many patients can you treat in a day with this sort of in your
I can
clinic?
do easily about 400
really?
in a day. Yeah.
400.
And most of my staff, they know how to do that because we have been doing that a lot for Salamat Doc. Saturdays and Sundays. We just rested for about a month or so. But it's so easy to do it. That's why one gymnasium we can easily do in just 3 or 4 hours.
Really? Wow.
It's only 15 seconds.
What would be the hardest ailment that you have
treated? These are the, what you call this, the ones with severe osteoarthritis. It takes too much time and strokes. These are the difficult cases because you have to teach. We transfer technology. That's the biggest problem with us. Like in scoliosis, we teach the mother what to do so that when the child who is a type A personality, type A's are, you know, they're obsessive compulsive, they're driven, they're very sensitive. That's why just a little emotional load, they go into muscle spasm or asthmatic attacks or migraine headaches.
Okay, good. Well, we're gonna continue this fascinating talk, but we're gonna have to take just a short break, and don't anybody go away because we're gonna be back talking with Dr. Chris very soon. See you. Welcome back. We're here talking with Dr. Chris about the relief of chronic pain. And Vinci, if it's okay, I'm going to ask you to be a model. And because we've talked about the therapies or the manipulations that the doc does, but it would be nice if you could just show us some of the basic things that you do. So, Doc, show us what you would do with Vinci. Just take a look at her and what you might address.
A lot of people, they don't know that their body is not really well tuned. In her case, she looks relatively very young. So we presume that there's nothing wrong compared to somebody our age, of course. But if we check, you will notice that this one is normal and this one is stuck up on the right side. When you turn to the left side, you will notice that this one is 5 inches off. And this one is normal. It sticks. My thumb sticks right to my hand. This one is quite far. So don't move. The pain you feel is the pain I took away. Okay? Did you understand that? Okay. Just relax. Give me your hand. Relax now. So she's normal now. Look. Very, very normal. And this one? Very, very normal. Normal also. How do you feel?
Feel fine.
So fast,
refreshing.
actually. Very refreshing. It's only 15 seconds to execute.
And you're not, and I would like everybody to really understand that Vinci never met the doc before we got in here this evening, and so this is not something that we put up or anything else. And is that simple?
After the manipulation, we look for the islands of fibrocytic nodules. These are accumulation of lactic acidosis under the fascia, and these are the ones that are called lamig. And we have special machines to remove that.
I see it. And these machines are electronic, or are they?
Yeah, it's electronic. We're using Australian machines because Australian machines are quite strong. The U.S. machines are relatively low wattage
I see.
compared to the Australian machines, and relief is very, very fast. We have a joke in our clinic. If during treatment you sleep, we charge you double. If you snore, we charge you triple. Because after the manipulation, you feel so nice, and they sleep right away. In just 3 to 5 minutes, they start sleeping.
And what this this electronic treatment, it's actually
A ultrasound, a therapeutic
it's ultrasound.
yeah.
Okay, okay.
But we can make it go very, very deep, deeper than 5.5 to about even 8 centimeters to 9 centimeters deep. Depends on the degree of muscle spasm.
Okay, now you mentioned before a specific pressure of 13.2 kilograms of pressure
for the thrust,
to do whatever it is that you do. How did you come to that number?
If the speed of manipulation is much more than 15 seconds, the relief is not fantastic. And if the pressure is too light or too heavy, it doesn't give the desired results. But if you are manipulating in that range, it's just like magic, especially for strokes, because strokes, their hands will start to relax, especially those with locked hands. When you manipulate them, it relaxes right away.
Now, how long will Vinci feel like, hey, wow, this feels good? I mean, is it just for a few minutes, or is it going to be for a few hours, or a few days, or?
You evaluate a myofascial release after 3 days, on the third day. That's the time when everything will relax, because you'll be sleeping at delta in the next 3 days. What's delta sleep? That's the deepest sleep of all. That's deeper than dream sleep. That's where 80% of all our growth hormone is released, or our repair hormone. That's why you feel so nice, and you feel more relaxed. You're not very stressed anymore. Okay?
Okay, now, you've done this manipulation with her. You say she's for 3 days she's going to be in delta sleep, and then you would check her again, I assume.
Yeah.
What would you be telling her to do in her life, her lifestyle, compared with what she was doing before she saw you?
The first thing we actually teach the patients is on lifestyle, on the diet primarily, because it's the diet that makes us very, very acidic. A lot of things we take have a pH of 2.5. That's nearly the same as commercial grade muriatic acid. A lot of cola drinks will fall under that category. So if you stay away from the very acidic things, because any area of pain is an area of acidosis.
Okay.
And the only way to resolve the problem of acidosis is to neutralize it with an alkaline. And of course, we will give an alkaline if it is needed. But the manipulation is simple enough. It improves circulation right away.
Okay, and you mentioned before that it's acidosis, and so pain is caused by acid, I suppose. But you were mentioning that most of the medicines we take for pain are acids themselves.
Yeah, mefenamic acid, acetyl salicylic acid, they're acids.
So